Hi, my name is Mina Ibrahim, and I just want to take a moment and thank SAGES for allowing us to present our work, which is going to be the long-term outcomes of magnetic sphincter augmentation in sleeve gastrectomy and Roux-en-Y gastric bypass patients. Here are our disclosures. So a little background, GERD in post-bariatric surgical patients is difficult to treat. There are not a lot of great tools for GERD management aside from converting a sleeve gastrectomy patient to a bypass. One technology that has emerged and has recently been used to mitigate this problem is the use of magnetic sphincter augmentation. However, there are a few studies associated with outcomes in this, and even fewer studies showing outcomes greater than 12 months. So our goal was to assess short-term and long-term effects of the use of magnetic sphincter augmentation in post-bariatric surgical patients with GERD. Our primary outcomes were to assess GERD qual scores. Our secondary outcomes were to assess daily PPI use, symptom resolution, and device tolerance. In our methods, we reviewed charts within our institution. We followed patients from 2016 to 2023 that underwent magnetic sphincter augmentation implants who had bariatric surgery with GERD. Our patients were followed short-term for 2 weeks, 1 month, and then a year, and then greater than 3 years as a long-term follow-up group. So how do we select our patients? Well, we have a particular algorithm that we follow. We separate our patients in our sleeve group and then also a Roux-en-Y gastric bypass group. Our patients that had a sleeve, we looked at their BMIs. If their BMIs was less than 35, if their sleeve morphology was normal, if their pressure within their sleeve was normal, then we assessed their LES pressures. If their LES pressures were lower than 18, then those were the candidates that underwent magnetic sphincter augmentation. All hiatal hernias were fixed, and patients that had a Roux-en-Y gastric bypass in the absence of any structural issues that we saw that can explain GERD, if they had an LES pressure lower than 18, then those were also candidates for magnetic sphincter augmentation. This is how we evaluated our patients pre-implant. Some demographics, the 100% of our patients were female. There was 16 patients within our cohort. The average BMI was 33. 13 out of 13 patients had Bravo studies that were positive, and all our patients had, again, low LES pressures, less than 18. From our group, of the 16 patients, 14 had a prior sleeve gastrectomy, 2 had a prior Roux-en-Y gastric bypass, 1 patient was converted from a sleeve Roux-en-Y gastric bypass to a Roux-en-Y gastric bypass at the time of MSA implantation, as their BMI was 41. 38% of our patients had a hiatal hernia repair at the time of device placement. Typical symptoms that the patients reported were reflux, regurgitation, and dysphagia. Acid reflux was the most common, followed by regurgitation, followed by dysphagia. They also reported some atypical symptoms, such as which included foaming at the mouth, throat pain, hoarseness, epigastric pain, and hematemesis. So what did our results show? Well, we showed a significant improvement in the GERD qual scores from pre-implantation to actually normalization immediately after in the short term. And then at greater than 3 years, we saw that they were fairly normal. Reflux also improved in the short term and long term, with 25% of the patients only reporting reflux greater than 3 years. Regurgitation had a dramatic effect, with none of our long-term group showing any regurgitation symptoms at greater than 3 years. Daily PPI use also decreased long-term. Dysphagia, although had a slight decrease, wasn't as dramatic as the other symptoms, and BMI was stable throughout. Our explantation rate was 19%. There was no device erosion or migration. So limitations with this, we had a small sample size. There was not 100% follow-up. We only had 8 patients from the 16 followed up greater than 3 years. So in conclusion, this is the first long-term outcome study greater than 3 years using magnetic sphincter augmentation placement after bariatric surgery. We showed that GERD qual scores normalized in the long term. We showed that regurgitation also resolved in all our patients. Daily PPI use also decreased. So in conclusion, magnetic sphincter augmentation is a durable option for GERD management after bariatric surgery with careful patient selection. Thank you.